have the distinct pleasure of introducing a man who needs no introduction to start us off. Haile Debas is the founding executive director of Global Health Sciences here at UCSF and renowned worldwide for his leadership in global health. Not only is Dr. Debas an amazingly creative visionary, but he has also an incredible record of action. Dr. Debas is a preeminent role model for many of us in the field of global surgery. His mark on global surgery is living in perpetuity as he has been instrumental and continues to be in defining the field. On a personal note, by a ridiculous fluke in the schedule, as an intern I had the opportunity, and probably Dr. Debas doesn't remember this, but I had the opportunity of operating with him. And I thought at that time, oh my goodness, he's larger than life, and I was absolutely terrified. And somehow made it through that experience. And now, as I stand here today, I realized that back then I didn't even know how much of a giant Dr. Debas really is. So it's my great pleasure to start us off with Dr. Debas.
Thank you, Rochelle. I'm dumbfounded. I actually don't remember you. And then it was a long time ago. So, Dr. Decker, Dr. Gillian, ladies and gentlemen, let me also welcome all of you on this auspicious occasion, marking the official launch of the UCSF Center for Global Health, for Global Surgical Study. The center expands the dimension of global health at UCSF by joining other highly successful centers with national and international repute. UCSF Global Health Sciences and the Institute of Orthopedics and Traumatology are particularly important in this regard. I'm very pleased to see that the leaders of both institutes, Dr. Jaime Sepulveda and Dr. Ted Nicolau, are here to celebrate and support. The attempt to develop a formal global surgical program at UCSF goes back over 10 years. Several individuals, among them Bill Schechter, Diana Farmer, Turuk Ozektis, worked tirelessly to accomplish this, and in so doing kept the enthusiasm for global surgery alive at UCSF. But it took the leadership, vision, and energy of two young, gifted, and energetic faculty members to succeed in finally making the dream a reality. Congratulations, Rochelle and Catherine. Let me also express my appreciation and gratitude to Dr. Nancy Asher, the chair of our Department of Surgery, for appreciating Rochelle's and Catherine's vision and for providing the necessary startup resources. The creation of the UCSF Center for Global Surgical Studies increases considerably the competitive advantage the Department of Surgery will have to recruit the best and brightest students and residents. It also puts it in a leadership position among its peer departments nationwide. 2015, I was going to say a vintage year. It is a vintage year. It's a very special year. A year when the stars for global surgery seem to be aligned. In a single year, we are witnessing the publication of two landmark pieces of work, the Essential Surgery Volume of Disease Control Priorities, 3rd edition, and the Lancet Commission on Global Surgery report. These two publications have placed global surgery prominently in the global health agenda. And now we celebrate this 3rd significant global surgery event of 2015, the launching of the UCSF Center for Global Surgical Studies. Once again, UCSF is at the leading edge, and I'm confident that departments of surgery across the nation will follow UCSF's example and create similar centers. The launch of our Global Surgery Studies Center gives me a unique opportunity to recognize and pay tribute to the man who, in my opinion, was the primary architect who put global surgery on the global health map, Dean Jemison. Dean is one of the world's leading health economists and has been the chief editor of all 3 editions of DCP. In fact, Bill Gates is said to have stated that reading DCP-1 was what stimulated his interest in global health. Dean, we're delighted that you're back on the UCSF faculty and here today. Please join me in expressing our collective gratitude to Dean. Both DCP3 and the Lancet Commission for Global Surgery have concluded that universal coverage of essential surgery should be publicly financed early on the path to universal health coverage, given that it's affordable and highly cost-effective. We now begin the long road of implementation of these recommendations. A key requirement for success is surgical leadership. That's why centers like the one we're celebrating today are important. Their leverage of the enthusiasm, optimism, and energy of students, residents, and faculty will provide global surgical solutions. They will help generate rigorous research data that will form the basis for building the case for global surgery. They will develop the training and competency standards that will be necessary to develop context-specific essential surgical services in low-resource settings. Over the years, it has become clear to me that success in global surgery will be critically dependent on the multidisciplinary approach, not only within the surgical profession, but more broadly with other health and non-health disciplines. I hope multi- and interdisciplinary approach will be the hallmark that the UCSF Center of Global Surgical Studies will adopt. Let me close by congratulating the Department of Surgery, and particularly Rochelle and Catherine, for this landmark achievement, and I wish you spectacular success. Thank you.